Today in dentistry, dental implants have become the standard of care to replace a tooth. Those implants are used not only to replace single teeth, multiple teeth, secure dentures. No longer do we prefer to use a removable bridge, a removable denture that's not secured by an implant, or a cementable fixed bridge which requires anchoring it and irreversibly damaging adjacent teeth. The dental implant today is by far a superior restoration over anything we've done in the past. The utilization of a dental implant today is determined by what we're going to be doing. Are we replacing a single tooth? Are we securing a denture? Are we securing many teeth? It avoids us to cause irreversible damage to adjacent teeth, preserve not only bone, but also gum line and tooth structure as well. Implants come in many sizes, shapes, diameters, lengths, and it's not one size fits all. It's very important that it be planned precisely for a long-term solution for the individual, whether we're using it to secure something that's removable for a patient, or we're using it for a person who's an extremely heavy chewer. We need to make sure that it's planned correctly for them. We want an implant to be able to be placed for a patient and to be a lifelong solution.